certification. Please note that questions can be submitted on the bottom right-hand side of your screen throughout the webinar and will be answered at the end if time allows. A recording of the webinar will also be sent to everyone later today. Without further ado, I would like to introduce your presenter for today, Elisa Schickel, Senior Manager and Leader of the Physician Practice Advisory Team of Grassi Healthcare Advisors. Alicia, please take it away.
Hi, good afternoon, everybody. Thank you so much for tuning in. This is perfect timing for this webinar on compliance. Lauren, can you go to the next slide, please? Great, thanks. So we're going to talk today a little bit about compliance programs in general, and specifically we're going to focus on some of the requirements for the New York State Office of the Medicaid Inspector General compliance certification requirements. Next slide. So we talked about why are compliance programs so important, because in today's environment, in the world we live in, we're highly regulated, we're under high scrutiny. There is an expectation of compliance, right? Every day, my day-to-day work, I'm sure all of us, we're seeing things pop up all the time. Providers are being hit with overpayment, recovery demands, there's a watchful eye for fraud, waste, abuse, and not only fraud, waste, abuse, but also errors. So compliance programs are crucial today more than ever. Next slide. This is a big reason also. These are the 5 statutes, rules, regulations that make up the health, Medicare, Medicaid laws, regulations. Providers are faced today with dealing with False Claims Act. Again, that's not whether you knew, but whether you knew or you should have known that claims are being submitted inappropriately and payments were being made that maybe shouldn't have. Again, there's the Anti-Kickback Statute, the Physician Self-Referral Act, there's the Exclusion Statute. We're going to talk about some of this as we get into the meat and potatoes of the program, elements of the program, and then the Civil Monetary Penalty Law. Next slide. One of the things I find a lot, we're always, shouting from the rooftops how important having an effective compliance program is. And a lot of times, I think providers don't really think that it has, it makes a big impact on their bottom line. However, from my experience and, compliance, not having a compliance program can really have a significant impact on providers' bottom line. Right? When you're faced with a situation where you wish you really had implemented an effective program, and now you're finding out just how much it really can impact your bottom line when you're facing financial significant overpayments and legal fees and consulting fees. So I think that's just not a good excuse anymore. What are some of the benefits of a compliance program? So we always say, look at it as an insurance policy. In today's regulatory environment, it's probably one of the most important insurance policies you could ever have. I mean, unfortunately, I've done work with many providers who have often said to me, geez, I really wish I had done this before. I wish I had known how important it is to be, auditing and monitoring my practice. We really could have mitigated or avoided some pretty significant situations. This is a tagline that I use all the time. I get teased about it, but it's not about getting paid in today's environment, right? It's about staying paid. And just because you get paid doesn't necessarily mean you should have, right? We know those claims get submitted, modifiers get put on them, it opens the floodgates for payments to go through, and there's a lot of times when you're submitting claims that there are no edits in place on the payer side to actually stop those payments from going through. We're going to talk a little bit about, as we get deeper into the presentation, about what the payers are actually doing about that now, right? We're seeing more and more providers getting put on free payment review. I just recently went to the National Healthcare Anti-Fraud Association annual training. I go there for continuing education credits for my accredited healthcare fraud investigator certification. And, I do a lot of provider defense work, and I always feel like a spy when I get there, because you know, the majority of the attendees are health plans, and they all come together and they all talk about, you know, what are they going to do to protect the plan funds, and, you know, how are they going to save money? And one of the big things that they've been doing lately is no more pay and chase, right? They're auditing providers. They're putting outliers on prepayment review. And they are, when claims are submitted, they're asking for that documentation in advance. Providers, if you don't submit the documentation, if the documentation doesn't support the services you're billing for, those claims are denied. And then the only remedy you have beyond that is now appealing those claims to get them payment. And the savings that they are showing are staggering. So you can be rest assured, you know, they're sharing information, they're sharing their models, what's successful, what's not successful. So I really wanted to put that out there. Your compliance programs really help you internally detect fraud, waste, abuse, and not only that, but errors, right? I mean, just in the day-to-day, there's so many processes in our revenue cycle that are vulnerable to errors, mistakes, and those are not an excuse anymore, right? We have an obligation, if we're submitting claims to the health plan, to make sure that we're monitoring ourselves internally to make sure that we're catching those errors, right? And then the program, when you have those processes in place, allows you to identify and fix those things pretty quickly. You can put in corrective actions. You can put in additional controls, which are going to help you prevent those issues from arising in the first place, and then also from reoccurring in the future. And that's a crucial component of what's looked for. And it all kind of boils down to promotion for better quality of patient care. Next slide. So I just want to bring awareness. Today we're really talking about the New York State Office of the Medicaid Inspector General program and certification requirements. But I just want to make everyone aware that which I'm sure you all are, there is an Office of Inspector General. OIG also has compliance resource, a portal on their website. They have great compliance program guidance if you're looking for guidance in implementing your program. Again, specific to your niche area, if you're a nursing home, if you're a hospital, if you're a physician practice, they have very detailed guidance plans there as well. Next slide. Okay, so New York State OMIG. We have a lot of information I want to get through, so please don't hesitate after the presentation to reach out to us, to contact us. If you have questions, we'll certainly do whatever we can to put you in the right direction, give you whatever guidance and support that we can. As Lauren mentioned, the website's going to be available, or the webinar is going to be available on our website after the presentation as well. So this is a link to the OMIG's website, and they have a plethora of information. So if you're a provider or an organization and you're not really sure if you meet the requirements to have a compliance program, or you think you do and you just want to, update your program, this is a really great place to get information. Next slide. I want to point out that I don't know if all of you have seen this portion of OMIG's website, but they have a section in there. If you go under compliance and you scroll all the way to the bottom, they have a section for webinars. This information is tremendous. It's very resourceful in helping you to, one, understand if you meet the criteria, which criteria. I mean, we're going to go through this at a high level today, but if you're looking for really more details on that, this is the place to find the information. These webinars not only give you very detailed, specific information of what your compliance program should include, but what it should be applicable to, which we're going to talk about today. And if you notice the little section there where it says OMIG Compliance Elements Webinar Series, that's all of this 8 sections of the compliance program, and it tells you specifically exactly, if you're audited, what OMIG is going to be looking for if they come and they audit your program. Next slide. Okay, what's OMIG's mission, right? Their mission is to prevent and detect fraud, waste, and abuse in the Medicaid program. Their mission is to recover improperly paid claims, right? They have to protect the money in the fund, and they also protect high-quality patient care. It's their job, their responsibility to conduct and coordinate investigations and audits and review Medicaid providers to make sure that they are complying with all the applicable laws and regulations. Next slide, please. One thing I want to add here, we're talking about OMIG, and one of the things we're going to talk about when we get to the criteria is whether it's money that you either order or receive directly or indirectly from the Medicaid program. And, New York State is a managed care state, so indirectly means those managed care companies like Health First, Fidelis, those are all considered part of this. So you may say, well, I don't really, meet that criteria based on your fee-for-service Medicaid payments, but it's all of your managed care payments as well, because even though it's indirectly, that money still comes out of the fund. So what's the role of the Bureau of Compliance? Basically, it's their job. They monitor and enforce the mandatory compliance program and the compliance certification requirements. Right? They coordinate and enforce corporate integrity agreements. If you've never heard of a corporate integrity agreement or not sure what they are, I mean, that's a whole nother webinar topic we'd love to talk about, but just in short, that is an agreement when providers are found to be in non-compliance that OMIG may, negotiate a settlement agreement with you and say, look, we won't kick you out of the Medicaid program participation. We'll let you continue to participate, but only under certain conditions. And always one of those conditions is implementing an effective compliance program, right? Corporate integrity agreements usually last 3 to 5 years. And they provide oversight. Make sure you're billing correctly, that you're reporting correctly. Also, the Bureau of Compliance assesses the compliance programs of Medicaid providers. So if you're certifying at the end of the year, yes, we have a compliance program. We're going to talk about all of that today. Hopefully it's more than a book on a shelf full of dust or being used as a doorstopper. Because if you ever get audited, it's not about having the book. It's about having the program adopted and implemented and being effective. So they also provide a ton of education and outreach to the provider community. You can see that just by going to their website. It's not like, hey, you're required to have this compliance program and we're not going to help you, even though they don't opine on your program or, what you should or shouldn't have, but they do give you great guidance of what should be included in your program. Next slide. Okay, they also can recommend termination from the Medicaid program. They impose sanctions, penalties, for providers who fail to develop and adopt or implement an effective program, right? They can also ask for exclusion. They can also have providers excluded from not complying with this regulation. So that's really important. Next slide, please. Okay. So I'm going to move through some of this quickly. Again, there's a ton of information. If we hit something and you're not 100% certain if it's applicable to you, the website, and again, please feel free to reach out to us. So we're going to talk about the mandatory compliance program certification, right? We say some Medicaid participating providers may be required to complete either one or both of the following certifications. So there's the New York State Social Services Law, and then there's the Federal Deficit Reduction Act. And they both have different requirements, and they both require certification through the OMIG website. Next slide. Okay, this is what the website looks like when you get there, right? So there are 5 certification categories under the Social Services Law certification. When do you have to certify, right? If you meet the criteria. Annual certification, enrolling providers need to certify that they have an effective program, providers who are revalidating their certification, Anytime that you have corrected insufficiencies which have been identified after compliance program review, you should recertify. And then again, certifying after receiving a notice of regulatory action for failing to complete your certification from OMIG. In the last few years, we've seen providers actually getting letters from OMIG saying, hey, you meet the criteria, or if you meet the criteria, you should be certifying. And then here's also the Deficit Reduction Act, a certification button here. Again, there's a ton of information as to which one of these is applicable to you, one or both. Next slide. Okay, so who must have a compliance program? All of these questions, ask yourself all of these questions, and if you answer yes to any one of them, then you meet the criteria and you are required to have a compliance program. So if your organization is subject to Article 28 or Article 36 of the New York State Public Health Law, if you are subject to Article 16 or Article 31 of the New York State Mental Hygiene Law, so this is where I think a lot of providers get a little bit confused, right? If you claim or order, and/or can be reasonably expected to claim or order Medicaid services or supplies of at least $500,000 in any 12-month period, right? Or if you are a provider who receives Medicaid payments or can be reasonably expected to receive payments, either directly from fee-for-service Medicaid or indirectly through the managed care organization of at least $500,000 in any consecutive 12-month period. So what does that mean? It doesn't mean just if you are collecting $500,000, it means are you ordering services that will generate that $500,000 out of the program, right? So every prescription you write, every MRI, every test, everything that's attached to you gets accumulated towards that $500,000. So you personally may not be collecting it, but say, for instance, you're a pain management provider and you're sending your patients out for MRI and you're giving them prescriptions. All of those things collectively go towards that dollar amount, okay? So that's really important. And a lot of times I talk to providers like, nah, I don't meet that criteria. And then after we kind of talk about that, they go, oh, wow, we probably really do, right? This one I love, the last one here, right? If you submit Medicaid claims of at least $500,000 in any consecutive 12-month period on behalf of another person or persons, you are required to have a program and certify it. What does that mean? After this webinar, you might want to call your medical billing company if you outsource your billing and make sure they have a compliance program, because that's what that means. And it doesn't mean, it means collectively. So if your billing company, outsourced billing company, has 100 clients, and for each one of those clients, they submit a small portion of Medicaid claims, if collectively all together that dollar amount comes to $500,000, then your third-party billing company is required to also implement and certify their program. Next slide. Who keeps track of all of this? OMIG calculates based on the claims information whether a provider meets the threshold based on the provider's identification number. So if you meet the requirements for any one of the criteria, then you should have a compliance program. Next slide. Okay, the purpose of the compliance program. When we've been talking about this, I think, since we started here, but identifying billing and overpayment issues quickly, right? One time at our Healthcare Compliance Association annual meeting, OIG, Dan Levinson, was talking to us, and he says, you know, if people nowadays aren't sure like what their risk areas are, then I say to them, follow the money, right? Follow the money, your claims, your revenue cycle, right? That's what puts you in the most danger. It's not the only area, but it's the biggest area, right? So follow the money. The purpose of the program is to resolve issues timely and prevent them from happening again. That's crucial. And if you're ever audited or you get in trouble or you have an issue, One of the questions that the enforcing bodies are going to ask you, like, did you ever have this problem before? Have you ever been audited? Are you auditing yourself? You know, and if they find that this is a systemic issue going on in your organization for a long time and you haven't done anything to look for these issues, to find it, to mitigate it, to stop it, I think they probably will be looking much harsher on you than had you had processes in place to identify and detect these issues and then correct them and prevent them from happening in the future. Putting controls in place, right? That's huge. What are some controls? We talk about policies and procedures considered a control. Auditing is a control. Education and training is considered a control. And then again, like implementation is key, right? You have to adopt the practices that you are developing and you have to test your program for effectiveness. We talk all the time about, hey, this is great. We have a whole slew of policies and procedures and we're going to talk about those. But if you're not checking to make sure that your policies and procedures are actually working or effective, then they're pretty much useless, right? So another thing I love to say, like if you're not finding issues within your organization, then you are probably not looking in the right places, because in the world we live in today, it's just the nature of our business. There's always areas of weakness and vulnerability, especially on the claim cycle and as part of your revenue cycle, right? So it's crucial. Next slide, please. Okay, programs should be unique. This is another tagline that I love to use when we're talking about compliance programs, right? The house is the same. We're going to talk about that, the structure, but the furniture is different, right? Every different type, every practice is a different size, has a different specialty. Every different niche area in healthcare has their own set of rules and regulations that apply to them, right? It's not a one size fits all. It's not a cookie cutter out of the box compliance program that you can just say, okay, we have it, we did it, we're good to go. Again, you know, having the book on the shelf is not going to help you when it comes down to it, right? So the size, the complexity, the resources, the culture are all going to be different, but they still certainly can be effective as long as your program's meeting the requirements. Next slide. Okay, now we're going to get into some of the meat and potatoes here. Written policies and procedures, right? What are they? So these are the 8 elements that OMIG sets forth of what your compliance program should have. Again, if you have a federal program implemented, they have 7 elements. The one major difference between the New York State OMIG compliance program and the federal OIG program is really like that 8th element here, policy of non-intimidation and non-retaliation, right? So policies and procedures, what is that? That is a way that you communicate with your employees your expectation of compliance, right? We should never, ever develop or implement policies that we don't follow, right? That puts your organization at more risk than if you probably didn't have a policy in place for that in the first place. Policies set your code of conduct, right? And they should be developed in lay terms. So everybody should be able to understand what your policies and your procedures are. One thing we say, you know, always when we're helping our clients implement their compliance programs, set your code of conduct, right? Because the tone comes from the top. Also, making sure that everybody has a chance and opportunity to review those policies and procedures and ask questions about them. And then from a leadership perspective, we always ask that our employees give us an attestation. You know, don't come back to me, you know, 6 months after something happens and say, hey, I didn't know about that. Well, yeah, you did, because here's our policy on that. We went over it and you attested that you had an opportunity to read it and you did understand it, and you did have a chance to ask questions, right? So really important on policies. And again, those are considered a control within your organization. The second element here is have an employee who's responsible for the program and the day-to-day compliance oversight, right? This individual within your organization, depending on the size, can certainly have other duties. They don't have to be solely designated as a compliance officer unless the size and complexity of your organization warrants someone full-time managing and having day-to-day oversight here, right? I think New York State has the requirement that your compliance professional or responsible person is a W-2 employee, right? So you can certainly seek outside advisory help in developing and implementing, but your actual compliance person internally should be an employee, right? And it should be someone who has a level of understanding of what the compliance program is really all about. They don't have to be a certified coder. They don't have to know how to do the billing, but they do have to know what the program requires and just make sure that those things are happening. The audits are happening, the oversight, the training, and all of these things are happening, right? You know, really, like, you wouldn't want to designate your janitor again as your compliance officer because they do have to have some level of understanding to effectively oversee and implement the program. The third element of the program is training and education, right? Training for all employees, training for leadership, training for the board, training for the staff, all of the staff, right? When we talk about at least annual training on fraud, waste, and abuse, and what does that mean? It really should be custom to your practice. What does fraud, waste, and abuse look like in your organization? That may look a little different than it does in someone else's organization. You should have orientation, training and education, compliance training as part of orientation. So all employees, new employees coming on board, they should also be trained, right? I can't stress enough how important you should have job-specific training, continuing education for the individuals, employees in your organization that are responsible for oversight of the revenue cycle. You have a billing team, you also your quality people, right? If you're doing your billing internally, they should be educated. Give them opportunity to stay up on what's going on current in the industry, because what does that do? It only helps to mitigate your risk going forward. Okay, the next element here, open lines of communication. Everyone in the organization should feel comfortable to come to the compliance officer or any other high-level individual and bring issues of non-compliance, right? One of the funniest things I ever really heard, and I never really thought about this, but part of this element is having a way for employees to report non-compliance issues anonymously. Well, one time I was meeting with Mr. Babcock, who was overseeing the Bureau of Compliance, and he said, you know, we were out doing a compliance program assessment, and, you know, the practice really thought they had an anonymous way of, you know, reporting issues. He goes, and then we look, and there's the box right next to the ATM machine in their building. And most people probably wouldn't think much about that, except what does every ATM machine have? A camera. So there was a camera right over the ATM machine, right next to where they had their anonymous reporting box. Hence, you know, the reporting of possible non-compliance was not anonymous. So there's multiple ways of doing this. Larger organizations usually have like a hotline. If you're not a big practice and you just want to have someplace inconspicuous where someone could, you know, send a letter, drop something in a box. But really, you should have the culture and the tone within your organization that the compliance officer is friendly, right? Not like, oh, here she comes, you know, hide, or here he comes. So open lines of communication. Okay, number 5, disciplinary policies to encourage good faith participation and expectations of compliance, right? So usually when I start my compliance presentations to my audience, I would say, who here is responsible for compliance? And you know, sometimes I'm lucky, I'll get a few hands, and I say, well, hopefully by the end of our presentation, everyone here, I'm going to ask you again, everybody should be raising their hand, because everybody within the organization is responsible for compliance, right? So the disciplinary policies really say compliance is a condition of employment, right? You want to let people know what will happen if they, one, partake in noncompliance or issues that could put the organization or practice at risk. Two, if they see noncompliance going on and they don't report it, you know, that's just as serious. So, and then these disciplinary policies should be, you know, put out. They should be, you know, enforced equally and fairly across the board. And that includes, you know, someone, receptionist answering the phone or in the building department, as well as your leadership and your board. So across the board, nobody gets special treatment on this. Okay, number 6. This is a big one. I love this one. And, you know, after we get through the elements, we're going to talk about, you know, what are the things that your program should be applicable to. But this is a big one. You really need to have a system in place to detect risks, right? What does that mean? You have to be doing internal policing. You have to be doing audits. You have to be doing self-assessment. You really don't want to wait until the payers or OMIG or the enforcers come in and say, hey, guess what? We've been looking at your claims data, which they do, at a macro level, and we have identified this issue. You now owe us, you know, $10 million back. You know, and I say that, but, you know, I've seen providers who have actually had small overpayment, you know, actual dollar amounts, which then when the extrapolation gets applied to that, you know, they go back 6 years for across your entire patient population, and then a small overpayment recovery could turn into an extremely significant one, right? So please don't set yourselves up for that. Police yourself internally, look for risks, put, you know, processes in place to mitigate and avoid those types of situations for your providers. Okay, number 7, a system to respond to compliance risks and issues and investigations, right? You need to have a process or a system in place that when you do identify issues through your risk assessment, right? You're going to have your audit work plan set up. How are you going to handle those? You have to have a process in place to say, okay, when this happens, this is what we're going to do. And sometimes you may identify or come across things that are a little bigger than you should be handling on your own. So don't ever feel like you should not include your healthcare legal team or bring in outside consulting help. Usually in those situations, your healthcare attorney comes first, and then any additional support will work under what they call attorney-client privilege or COVEL to help you. But definitely internally, you need to have a process for doing investigations. Not everything you're going to identify is potentially going to be an issue, but once the flag goes up, you have to do the investigation to determine that, right? And then put your corrective actions in place. I can't stress enough as far as like corrective action, we'll talk a little bit more about this. Don't just put your corrective action plan in place and then, you know, okay, we're done, we did our deed, because you really don't know if that's going to be effective unless you go back and check and make sure that the corrective actions that you're implementing are actually working. You may need to switch that up a little bit. Okay, and then number 8 here. This is the 8th element of your compliance program. Again, this is the house. This is the foundation, the structure of what every compliance program should have. A policy of non-intimidation and non-retaliation for good faith participation in the program. Employees should not feel like they're going to get fired or demoted or shamed upon because they're bringing issues of non-compliance to your attention. I cannot tell you how many times I've been involved in matters where people did bring issues of non-compliance to leadership information and they didn't do anything about it. And they would bring that to their attention again, and they still didn't do anything about it. Well, guess what? Those are the types of employees that turn into whistleblowers, because if they're ethical and they're compliant and they know that this is not the right thing, if leadership does not take those allegations or those, you know, hey, here's a red flag, I think you should look into this seriously, then sometimes those people are now going to go over your head. And I can tell you that there's great incentive for whistleblowers nowadays, because they will, under the federal program, they're entitled to 33% of whatever the government recovers. So take it seriously. Maybe go back to that individual and say, thank you so much for bringing that to our attention. We're looking into it. You know, whatever. We're putting in corrective action, or hey, you know, we just identified, you know, that it was not a real issue or a risk, but thank you so much. Please continue to bring issues to us in the future. Next slide, please. Okay, we just talked about the house. Now we're going to talk about the furniture, right? Billing. Your program should be applicable. So now you have all of your house, your structure, right? You have your policies, you have your training, you have your open lines of communication. This is all the furniture that your house should be full of. You should have processes in place to oversee your billing. You should have policies and procedures in place about your billing. You should have training and education. You should be auditing your billing. One of the most crucial parts of your billing, documentation, right? Your documentation really is your first and only line of defense. So content compliance as far as documentation is just critical. Making sure that your documentation supports the services that you're billing for. Make sure that the codes that you're submitting are applicable to the services you're rendering. I can't tell you how many times we're brought in on matters and we hear from providers like, oh, I didn't know that was the wrong code. Well, if you had a compliance program and you were checking on these things, you would know. And it doesn't really come down to whether you knew. It's whether you knew or you should have known. And when you're submitting codes to the insurance company and you're slapping those modifiers on there that are now going to trigger payment, it's your obligation and your responsibility to know that what you're submitting accurately is representing the services that you're providing, right? Okay, off my soapbox. Payments. Again, when those payments are coming in, you have to be monitoring them, right? You need to be looking to make sure that the payments are appropriate. You're not getting overpaid. And from the perspective of the benefits of having a program, make sure you're not getting underpaid, right? That's critical. It's not about really just the benefits or the risks. It's about creating a level of integrity, revenue cycle integrity across your entire organization, right? Denials. If you're consistently getting denials, you need to be looking into that. Why are we getting denials? Well, apparently you're not submitting something appropriately. Something's not matching up. So that's a huge area that really could help mitigate risk and also increase revenue, right? Make sure you're checking on those payments. Put an audit trail in place. Medical necessity and quality of care. So this is, you know, always, I always get a lot of pushback here. Like, yes, coders can help with the documentation and they can help, you know, pick the bill, you know, the codes and we post the payments, but medical necessity really comes down to the provider, right? There are a plethora of resources out there of what Medicare, Medicaid payers consider to be medically necessary, right? We look for things, even if you're not committing fraud per se with intent, you still could be overutilizing services. You still could be for submitting things that the payer doesn't consider medically necessary. If you look at, for instance, like Medicare, they have local coverage determinations. Those are the types of resources that help you to understand what is and is not considered medically necessary, right? I mean, common sense, you're not going to be ordering an MRI for a patient who comes in with, you know, a simple splinter or, you know, something silly like that. That's a dramatic example, but, you know, it has to match up. It has to make sense. And the services, they're not going to be, you know, payers are not going to pay for things that are not considered medically necessary. Each plan, Medicare, Medicaid, some of the commercials have their own idea and their own definition of what they consider medically necessary. So it would behoove you to go and look that up and make sure that you are meeting that medical necessity criteria. Governance, right? This is a huge one. And governance means a lot of different things in a lot of different organizations, right? If you're a larger organization and you have a board, then governance of your program is the board. But if you're a small practice or a different type of organization, Maybe it's just management or leadership or your CEO, you know, or the doctor in the office, right? So governance. And governance should have oversight and be involved in the compliance program. It's really about creating a culture, tone from the top down. Your leadership should be involved in approving policies, right? They should really be an integral part of your compliance program. It should be applicable to mandatory reporting, right? They want you to make sure. So if you get audited by OMIG, your compliance program gets audited, they're looking for all of these things. Do you have a process in place to monitor yourself, to make sure that you are meeting your obligation for mandatory reporting? What does that mean? Do you have issues or errors going on that are creating huge levels of overpayments? Because we all know under the Affordable Care Act, there's a 60-day overpayment rule, right? Once you identify, substantiate that you have an potential overpayment, there are mandatory reporting requirements. And this goes as well for quality. Credentialing. So this is such a hot area, and you really wouldn't think so, but we see so much non-compliance in this area sometimes. I can't tell you how many times we're brought in to help providers who are in a significant overpayment recovery demand issue, and part of their problem is they have licensed providers or individuals who are not credentialed with the health plan, right? The health plans say, you must be credentialed provider to see our members. And if we audit you and we identify that the billing doctor is not the rendering doctor, and the rendering doctor is your non-physician practitioner who's not credentialed with our plan, guess what? You're going to have to pay back all that money. So making sure that your providers are credentialed is imperative, because it's not about getting paid, it's about staying paid. And no provider should think for a moment in today's industry that they are not low-hanging fruit, that they are, it's not a matter really like if you're going to get audited anymore. It's when are you going to get audited, right? So be prepared for that. Do not let non-credentialed providers see members, see patients, because you are setting yourself up for trouble. Under this area is also an element of exclusion checking, right? So you're not allowed to do business with excluded providers or individuals. So there's a requirement under the compliance programs that you should be monthly checking all of your employees and your vendors to make sure that they are not excluded. It's not just the excluded providers who can't do business in the healthcare environment under Medicare and Medicaid, but it's anybody else. They're not allowed to do business with excluded providers either. So that's a really, really important, I just can't stress it enough. And we see so much of it, which is why I'm really kind of focusing on that. And then this one I love, from the president of the Manhattan local chapter for the AAPC. And every month I coordinate educational meetings for our members, because again, everyone is, compliant and is applicable to everyone. And not long ago, we had Mr. Babcock from the Bureau of Compliance from OMIG come out and do a training session on all of this for our members. And I love, when he gets to this section, he's like, okay, other risk areas, this is the kitchen sink right here. This is everything else that we didn't talk about so far, as other risk areas that are or should be, with due diligence, identified by the provider. So really, what does that mean, right? There's so much information available out there. And when we think of risk, we think of, what is risk? It's the likelihood or probability of something happening. And then if it does happen, what's the severity of that going to be, right? That's what risk really means to an organization. And how do we identify risk? One, we already talked about follow the money, but look to your associations. I noticed when I was looking at the sign-up sheet for today's webinar, there were a lot of long-term care providers signing up. So Go to Leading Age. I just saw a fabulous white page that they had put out on compliance and compliance programs, and I mean, they can help you to identify what are other individuals, practices, organizations in your same niche going through. What are some issues that we're seeing out there? Right now, we know there's new payment models for long-term care, right? That's a whole new risk area for you, because now you have to understand the whole component. ICD-10 is now really going to impact your payments, right? Wow, that's something new happening. That's potentially a risk to our organization or association. Look to your history. What are things that have happened in the past? Those are things that you should be looking to make sure are not reoccurring. So those are all great areas of where you can be looking for additional risk. Okay, next slide. Okay, that's the house and the furniture. Let's talk really quick. We're getting down to our time is dwindling here, and I want to get through the certification process. So again, this is just a matrix that's very commonly used in healthcare, because once you identify a risk, you really have to rate them, right? So just quickly here, if you think about it, just because the probability of something happening might be low, if that did happen, the impact might actually be high, right, or moderate to you. So like, for instance, a HIPAA breach. Maybe you think that a HIPAA breach in your organization, probability, likelihood of that happening is pretty low, but hey, if it did, the impact could be really severe, right? So just keeping that in mind. Once you identify risks, you really now need to know, what are we going to do with them? We're either going to accept the risk, we're going to put controls in place to mitigate the risk, or we're going to avoid that risk completely because maybe it's too much of a risk for you to take on, or you might consider transferring it. And an example of transferring a risk is like, hey, if we do the billing internally in-house, it's a pretty big risk, but maybe we're just going to outsource that. So that would be a good example. Okay, next slide, please. Okay, how and when to certify. Okay, it's your responsibility, the provider's responsibility, to determine if you must have a compliance program, if you do have a compliance program obligation, right? And if you do, then the only way to certify your program through the OMIG site on their forms is electronically. Okay, if you're required to certify and you don't have, or you will not have that program in place before the annual certification is due, OMIG says you have to get your house in order and immediately start taking steps to implement and maintain the compliance program, okay? Failure to do that may result in further action against you by OMIG, right? So next slide, please. Okay, we talked about this initially in the beginning under the Social Security law, the 5 times when you must certify. Again, by December 31st, when you apply for enrollment, if you're revalidating enrollment, if you have been correcting insufficiencies, or again, if you receive a notice from OMIG. Next slide. Okay, this is what you're going to see when you're on the website. You've determined that you do meet the criteria. You do need to certify. You need to certify under the Social Security law. When you log in, these are the things that it's going to ask you for. Certification category. Well, those are the 5 things we just talked about. Are you enrolling? Are you revalidating? So it's going to ask you to select one of those. Why are you certifying today? It's going to ask for your compliance officer information. It's also going to ask for your certifying official information, who's been designated internally to be your certifying official. I can't stress, and I'm just going to make this point, I'm going to make it here, because if you are the person who is listed as a certifying official and you are clicking that box, I agree, and you are attesting and you are certifying for your organization that you have met all the criteria and you really haven't, then you personally can also be penalized, charged with a felony, just like the provider. So if you're designated the certifying official and you're submitting this form, then you darn sure better make sure that all of these things are accurate, right? Don't certify to something that you're not doing. And then here's the criteria under the SSL certification form of what are you certifying to, right? So, and you can see all of this on the OMIG website. If you go there, go to certification, just click on the SSL button, and it'll take you here, and you'll be able to read all of this. They also have a really great self-assessment tool. It asks questions. It will take you through it step by step to help you make sure you can check that box off to say, yes, we really do have this. And not, yes, we have it on the shelf in a book, but it's implemented, right? That's what they're looking for, evidence of implementation. Okay, next slide. Okay, Deficit Reduction Act, Compliance Program. This is the other certification form. The New York State Compliance Certification does not satisfy your filing requirements under the Federal Deficit Reduction Act, which establishes requirements about the False Claims Act. And we don't have enough time today to really go into the nitty-gritty of the differences, but you can find all of that information on the website. And actually, here's, if you go to the compliance tab, it'll give you like a frequently asked questions, all about this. They're separate. Remember, the two certifications are separate. They have different requirements. Sometimes you may be required to only submit certification for one, but sometimes providers are required to submit certifications for both. Okay? Also, just a little caveat, maybe you're not even a New York State provider, but you work in Jersey. But if you do you meet the criteria that you're submitting claims for New York Medicaid, then you also meet these requirements. Okay, little caveat there. Next slide, please. Okay, this is what it looks like when you log in to certify under the DRA. They're going to ask you again, what's the corporate provider information, who's your compliance officer, who's your certifying official, and then here's a list of the specific questions. They want to know, do you have written policies and procedures for your employees, your management? So there's a whole list of things here. Do you have an employee handbook? Yeah, so you can read through all of this. And this is very specific to the False Claims Act, fraud, waste, and abuse, which is just, you know, I mean, there's just so much of it out there going on. Next slide, please. Okay, some final tips. I mean, we've kind of been poking you with these through the whole webinar, but I just think we just can't reiterate enough. Listen, ask for help if you're not sure what to do. Like, the website really is self-explanatory, has a lot of great information. Maybe you don't have resources internally to do all of this. So you can always reach out, ask for help. Your health law attorney or your in-house counsel should be able to give you some guidance as well. Utilize the website. Go check out those webinars. They are amazing. If you are not sure what each one of those elements should include, what is OMIG going to look for when they come in if I ever get audited, it tells you, it spells it out very clearly. What are they looking for if you get audited, and what you should have in place. And you shouldn't really think about this whole process as like, another, you know, unfunded requirement from us. These things will be your saving grace sometimes, right? How many times providers, they just say, like, I wish I had done this, I wish I had known. Just do it already. Okay, determine who's going to be your certifying official. Again, do not make false statements. Do not attest that you are in compliance if you are not. Setting yourself up for a very serious situation there. Okay, and again, certifying by December 31st. You know, it's fast approaching. So I think we have like just a couple minutes left, and I'm happy to take a few questions. Hopefully I can answer them. If you think of something after the webinar that I didn't cover, I know I spoke a lot, like I'm a talker. So, you know, please feel free to reach out to us. We're so happy just to point you in the right direction, give you some guidance. Next slide. I just want to say, you know, of course, if you need help with any of these components, we have, you know, years and years, over 30 some years of experience helping providers developing, implementing, putting their programs in place, doing their assessments. We also have a great team at Grassi of coders that we can help you with pre-billing coding. We can help you just do some quality assurance validation of your own coding team, make sure they're coding properly. We also do chart audits for compliance and due diligence purposes. We can help you with consulting on your risk assessments. We provide custom education and training. We can help with exclusion checks. And unfortunately, we do a lot of work with providers who need corporate integrity support. So please, we're here. Even if you have a simple question, we might be able to point you just to the right direction of the OMIG website. I don't know, Lauren, do we have time to take a couple questions? I'm happy to do that now.
Yeah, just want to reiterate that a recording of the webinar will be sent to everyone that signed up for the webinar. It doesn't look like we have any questions coming through, but again, you can submit them on the bottom right-hand side of your screen if anyone does want to stay on a few minutes extra and ask any questions for Alicia.
I hope that doesn't mean that you're all in shock now. And I'm going to say, even though I can't see all of you, like, who here is responsible for compliance, right? I hope you all have your hand up. Yeah, I mean, if you think of something after and you'd like to reach out, please feel free. I'm happy to help with that.
It doesn't look like any questions are coming through. Alicia's contact information is on the screen.
Thank you so much for doing this today.
All right, thank you all. Have a great day.